Hello, dear students and esteemed learners. Welcome to our course on Sociology of Health. This is the eighth lecture of our course, and the topic that I have included for today's lecture is Marxist perspective on health, disease, and medicine. This is also known as conflict perspective. And in this topic, I've covered multiple subtopics. Just to name a few: Karl Marx, a very brief introduction for people who are not aware of Marx, then Marx and Engels on disease, Marxist approach on medicine and medical profession, Marxist view on healthcare, then Marxist concept of health, which is also known as political economy of health, and then the main criticism of the Marxist perspective. We will talk about all these subtopics in this lecture. But before that, let me put the Marxist perspective in the overall framework of the theoretical perspectives to understand health, illness, and medicine. This is our second week's course, and prior to this one, we talked about the biomedical perspective and then the functional perspective. So, the biomedical perspective basically helped us to understand the growth of modern medicine in the 19th and 20th century. And we all know that the biomedicine perspective is very important in terms of finding certain medicines and then inventing certain tools and instruments which are very helpful in conducting modern surgeries and curing the multiple types of disease. However, there were certain limitations within the biomedical perspective, and those were pointed out within the medical sciences as well as outside the medical sciences. Right? And then there were, because of those criticism, the system improved itself. Then we talked about the functional perspective. Now, that functional perspective helps us to understand the healthcare system, because medicine is only one component of the larger healthcare system. But the system is basically including the medical professionals, the paramedical people, then the labs, the pathological labs, and several other things basically. So, what kind of system basically was existing in the mid of 20th century, that was explained very well by Talcott Parsons when Parsons talked about hospital as a system. So that way, biomedical perspective helped us to understand the growth within the medical sciences. Then the functional perspective helped us to understand the hospital and the healthcare system at a larger level. And then the role of the physicians or doctors in that system, then the role of the patient, and several other things related to that. Now, we will talk about the Marxist perspective, because Marxist perspective is often considered as a critique of the functional perspective. But along with that criticism, the Marxist perspective is also known as for the macro kind of understanding about the society. So this perspective will help us to understand where the health system is located in the larger economic and political system or economic and political structure. Because we know that in the society, there are political system, there are economic system, because the society operates like that. So healthcare system within the larger political and economic system is located at certain point. The Marxist perspective helps us to understand that, and that is why this is very important to understand. And so now we are moving to the various concepts that we have included in today's lecture. But before that, let me tell you one more thing. Marx is a big philosopher. His views are actually studied in most of the social sciences, and not only social sciences but also in humanities, literature, and at so many places. So it will not be possible for us to talk about Marx or his all concepts in one lecture. So what we have tried to present the few core arguments presented by the Marxists in this lecture, and then tried to see the implications of those arguments in specific fields like disease, illness, health, etc. So we will try to understand those things within the constraints of time. A very brief introduction of Marx. Karl Marx, as we all know, a German philosopher, basically lived in 19th century. He worked primarily in the realm of political philosophy and was famous advocate for communism. He was a revolutionary, a philosopher, a sociologist, a historian, and an economist. That means multifaceted he was, and his writings were. Then he wrote with Friedrich Engels, his good friend, the Communist Manifesto, which became very popular. And he is also the author of several volumes of Das Kapital. And then Marx talked about basically class relations. For Marx, class is an omnipresent institution. That means class exists everywhere in all relations, and you can find the class operating in almost all the processes if you look at the things from the Marxist perspective. How do we define class? We will not cover this particular topic here. Very briefly, just let me make you understand that Marx looks at the society from the economic perspective, and so he is also known as economic determinist. He divided the society into two components: the base structure or the infrastructure and the superstructure. And within the base structure, he talked about the mode of production. And Marx talked about two types of relation with the mode of production. Those who have control over the mode of production, that is, those who have that, those who own that. So they are identified as the haves, and those who don't own that, they are identified as the have-nots. So the haves are identified as the bourgeois, and the have-nots are identified as the proletariat. And these are the two main classes. So this is how Marx has seen the society in terms of two classes. And then Marx says that the bourgeois is actually exploiting the proletariat. And because of this, the proletariat are in conflict with the bourgeois. And this kind of conflict is identified as class conflict. So when Marx says that there is a class conflict in every society, except the socialist or the communist society, as the Marxists say. However, when Marx says that every society is a class society, and then he also says that the class conflict is omnipresent, and because of that, the Marxist perspective is also known as the conflict perspective. Now, we will go further. Marxist theory suggests that it is the economic structure of any society that determines the social relations. Now, whether those social relations are operating in the political arena or maybe anywhere else, everywhere the relations are primarily determined by the economic structure. The relationship which are basically existing in the form of haves and have-nots are getting reflected everywhere. So for the Marxist, this class relationship is existing in almost all institutions. For example, if you look at it from their perspective, then caste can be seen as a class institution. Just like that, whether you talk about family or you talk about the state or you talk about any other institution, in every institution, the class relation could be seen. And just like that, within the health institution, they have also tried to see the class relation. right? So this is how we will try to look at the things. It is the distribution of the ownership of the means of production that gives rise to a specific pattern of class relations. Society is composed of various groups struggling for advantage. Now, because there is a struggle which is also identified as class struggle or class conflict, so these class struggles are basically based on certain clash of interest. So certain groups will have advantage over the other groups, and it will cause a kind of inequality that is also known as a class inequality. And for Marx, inequality is a basic feature of social life, and conflict is the major cause of social change. So Marx also uses the concept of dialectics and says that this dialectics is the driving force of social change. So this is the larger perspective used by Marx. Now we will see the impact of this perspective, or the way this perspective is looking at the various concepts related to health and healthcare. First, we will talk about disease. Marxists argue that disease is the outcome of a capitalist economic system or a capitalist mode of production. Engels, in the book The Condition of Working Class in England in 1844, basically gave the picture of some of the districts of England, and he stated that some of the urban spaces in England, and he stated that because of the capitalist mode of production, there is a kind of lifestyle which is actually producing several diseases. So that way, disease is basically the result of the specific mode of production, which is the capitalist mode of production. And the industries basically are not using the safety measures. They are not providing the facilities which are required for people. They are not giving the kind of health benefit which is required, primarily the safety measures. And because of that, disease is occurring in those localities or in those situations. And this is known as basically the Marxian concept on social causation of disease. According to Marxists, the capitalist mode of production actually produces disease, and this is also referred as the social production of disease. Disease or illness could be produced directly in terms of physical, chemical, or biological pathogen at the workplace, that means the industries, or in terms of the stress or risks of accidents as a result of the increasing intensification and fragmentation of the work there, or in terms of the alienation which is caused during the production process. They argue that morbidity and mortality are higher among individuals doing routine types of work requiring low level of skill than among individuals working in jobs that demand a large number of skills, which allow for some type of control over one's own work. That means they are saying that the capitalist mode of production is creating different kind of work culture, different types of work environment. So those who are performing the labor type of work, they are prone to several types of disease, and those who are not involved in that kind of work, so they are actually not suffering from the burden of those kind of disease. So from their point of view, disease is caused because of the specific mode of production. Then Marxist approach on medicine and medical profession. In a Marxist approach, the function of medicine is the maintenance of the capitalist system. Now again, this statement may sound strange to many students, that how can Marx or Marxists say that the function of medicine is the maintenance of the capitalist system? So just 2 or 3 things we will talk about here, and you will get an understanding. Primarily, the capitalist system is based on the idea of profit, and for that profit, the capitalists or industrialists want that the workforce should remain engaged in work. Now, if the workforce is becoming ill or sick, then it will adversely affect the production and the profit. So medicine is helping the industrialist or the capitalist to keep the workforce healthy enough that they can keep on working in that or in those factories or industries. So that way medicine is basically used for maintaining the capitalist system. The medical profession controls labor through its control of the sick certificate. Now, earlier, when we were discussing the functionalist perspective, we stated that Parsons has said that the doctors are basically the gatekeepers of the role of sickness or the sick role. So that argument is basically further extended. Now, from the Marxist perspective, the physicians or the doctors or the medical professionals basically have a kind of control over the labor force because of their control over identification of the sickness or providing the sickness certificate. And so, through the medical profession or medical professionals, the capitalists have a control over the workforce. That is the larger argument. While the theories of disease, it develops and enforces individualize the cause of disease and ignore social factor. There is another argument that under certain circumstances, primarily as we discussed while we were talking about biomedicine, that biomedicine actually individualize the cause of disease. So that is what is again stated by the Marxist, that the modern health institutions primarily in the capitalist system of production individualize the cause of the disease and they ignore the social factors or they ignore the larger economic environment or the macro environment, right? So this way they criticize the existing healthcare institutions and they consider those responsible for blaming the individual for the illness or the sickness and thus performing an ideological function in stabilizing the status quo. So functionalist perspective is often considered as status quoist because that is supporting the existing mode of production or the system. And the Marxists are basically a critique of the functionalist because the Marxists consider the functionalist as a status quoist. And so this institution of medicine or the healthcare system is also considered as a status quoist because somehow it is projected that they work for the interest of the capitalist. Medical knowledge and technology do not have a separate existence from capitalist social relations. Rather, they are the product of the capitalism. So as we stated earlier, for the Marxist, every institution is basically a product of the capitalism. Every institution is basically a class institution. Just like that, this healthcare institution or the medical knowledge is also a product of capitalism, which works for the benefit of the bourgeois. Then we come to the next point, Marxist approach on medicine and medical profession. In the Marxist perspective, medicine plays both an economic and an ideological role in contemporary society, which can be summarized as follows. So there are different arguments and we have summarized those arguments. First, medicine is the object-centered rather than person-centered, treating the human beings as things. So earlier we also stated this argument that biomedicine considers the disease as a specific situation and the medicine primarily focuses on the disease, and in those situations basically the person who is witnessing or who is experiencing those diseases become an object of observation or experimentation. So this argument says that the existing healthcare systems primarily treat the human beings as things, as objects. Then disease is seen as a condition to be treated by chemical or electronic intervention to restore balance in the body rather than the outcome of the social relationship. Now this point is again very important because Marx looks at the society at a macro level, so for Marxist, if there is a kind of imbalance existing in the society in terms of class conflict, then they suggest class struggle for that. And they talk about basically the change of the system in the form of bringing a socialist and a communist kind of system. However, they say that medicine basically mediates, and all these medical interventions primarily try to intervene in the sense that they restore the body, or that means they help in recovering from the disease, and they ignore the larger social, economic, or political factors, or the larger macro factors. So that way we can understand the Marxist arguments. Then next point is this, that health is defined as fitness to carry out social role, particularly the ability to sell labor. That means from Marxist perspective, the capitalists are primarily interested in keeping the workforce in such a situation that they can continue to sell the labor so that the production process continue to perform, right? And so for them, health is basically that minimum condition in which a worker is remaining fit enough so that he can keep on working. It is not more than that. And then medicine focuses on the individual and the individualistic conceptions of lifestyle, and it actually is ignoring the larger macro level factors. Then we come to the next point, which is the Marxist view on healthcare. According to Navarro, the capitalist state's involvement in healthcare brings about three things. It reproduces the class structure, it reproduces individualist ideology, and it reproduces alienation. Now, these are very strong arguments, but if you are familiar with Marxian writing, then you all understand that Marx considers various institutions as in terms of rather in terms of their role in a reproduction of the capitalist system or reproduction of the labor. For that matter, they consider education as a mechanism which is helping in reproduction of the labor. That way, they look at this health system as a mechanism which reproduces the class structure, because it reproduces the individualist ideology. So it helps in keeping the focus on the individual and not on the larger society or not on the mode of production, right? So this is how they are looking at it. And then it reproduces alienation. Alienation is a kind of detachment. Marx and Marxists basically talk about different stages of alienation, and it begins with some kind of separation between the individual and his work, and it ends up with the separation of individual with his or her own identity, right? So that is the process of causation of alienation, and somehow this system is also helpful or supporting in reproduction of that kind of alienation. This is how Marxists look at the thing. With respect to ideology, state involvement in healthcare sustains ideas and practices which suggest that the causes of ill health reside within the individuals and their behavior. So from that framework, they also talk about the state and the larger healthcare systems. Finally, we can have two more points. Biomedicine, as it is practiced in modern capitalist economies, rarely focuses on the economic and political factors responsible for illness and disease. So the Marxists conclude that the biomedical system, which is basically dominating the healthcare system, this in a capitalist system or in a capitalist economy, it is not focusing on the larger socio-economic and political factors which are responsible for causation of disease. So that way it is helping in creating some kind of distraction, and it is focusing on the individual, and they basically hold the individuals responsible for the disease kind of thing. Finally, state involvement in healthcare reproduces alienation. So they consider the state also as a mechanism which is used in reproduction of the capitalist system. Now, after talking about all these separate issues, we will try to look at how the larger idea of health is being seen by the Marxists. And when we talk about health, then the Marxist concept is often also identified as the political economic perspective, right? So I have mentioned the word political economy here. Under political economy perspective, good health in political terms is defined not only as a state of physical or emotional well-being, but also as access to and control over the basic material and non-material resources that sustain and promote life at a high level of satisfaction, meaning that a key component of health is struggle. So, if you look at it from political economic perspective, then for them, health means making people capable of not only fulfilling their physical or mental capacities or requirements, but also keeping them prepared for the kind of class conflict that the Marxists are actually talking about. For political economists, ill, aged, and physically disabled people are marginalized by society because they do not contribute to the production and consumption of commodities. So they are not part of the larger workforce, and so they are marginalized. Other marginalized groups such as the women, the aged, unemployed, and the members of the working class tend to endure greater social and economic disadvantages than those from the privileged groups and have restricted access to healthcare services. Then, this restricted access to healthcare services result in poor health outcome for these groups. So prior to this lecture, we have seen some of the statistics when we were talking about the communicable and non-communicable disease. And we have seen that the prevalence of the most of the communicable disease was actually associated with the low income countries. And even in Indian context, we have seen that the prevalence of the communicable disease was basically associated with the states which were economically not performing very well. So, making observation from that kind of data, they are associating the poor income with a specific kind of disease and illness. And medicine serves to continue social inequalities, the divide between the privileged and unprivileged, rather than improve them. And then their core argument is this, that medicine in itself is a class instrument, class institution, and it helps in basically keeping the society divided and increasing the inequality. Political economy writers comment on the cultural crisis of modern medicine, in which healthcare under capitalism is perceived as largely ineffective, over-expensive, under-regulated, and vastly inequitable. So some of these points are very important, especially something which is related to over-expensive. Because again, the profit motive is there. The healthcare institutions are owned by the rich or the capitalists. And again, they have the profit motive. And for that reason, those are becoming expensive. And not only expensive, out of the rich of the lower income group. And the state, which is again a class institution, is not basically regulating the healthcare institutions well. And then all those inequalities are actually getting enhanced if we look at the things from the Marxist perspective. Then all these views, although helped in locating the functioning of the healthcare institutions in modern capitalist societies, but these are also criticized for the extreme views. Marx is criticized for multiple reasons. First of all, his views which are considered as economic determinist views, are criticized. Weber talked about multi-causal determinism or multiple causality, and then the functionalists basically have presented the entire framework to criticize the Marxist framework. And then the symbolic interactionists have also criticized some of the Marxist argument. And then we all know that the modern democratic societies have not accepted the Marxist arguments the way those were presented. So the Marxist argument, although help us to understand the functioning of certain institutions and also help us in seeing their relation with the larger macro structure, but some of those arguments are actually based on certain Marxist ideology which have not been accepted in most of the societies as of today. However, from academic perspective, it is important to understand those arguments because those give us a perspective to look at the things. And one more thing, health inequality is again a problem. The health of the marginalized groups are again a problem. So people who are interested in understanding those inequalities or the marginalization taking place within the institution of health, sometimes they do find some of these concepts helpful in understanding health and health institution in contemporary world. So thank you very much for your attention. It was a very complex concept, but I tried to make you understand within this constraint of time. Finally, there is a thing about this problem and an activity question that you can think and try to resolve. And this is the list of references and recommended readings. So thank you very much for being with me. I hope this lecture has helped you in understanding sociologically the health institutions, their emergence, and their importance in the contemporary world. Thank you very much.